My name is Amber Rice. This presentation has been created to provide a plan for stakeholder education about my dissertation project. The objectives for this presentation include: describe the clinical dissertation project, identify stakeholder groups and each group's role in the project implementation, identify educational needs for each group, and discuss the theoretical foundation underlying a proposed educational intervention, and outline a plan for delivering the intervention. The purpose of this project will be to examine if there is a difference in readmission rate for those patients experiencing the use of a teach-back assessment tool compared to standard care for adults being discharged from an inpatient surgical unit after 90 days. Questions on the teach-back assessment tool will address necessary information and essential skills to carry through discharge instructions for the patient. The teach-back assessment tool will be randomly given to a number of patients over a 4-week period. The tool will be given by BSN RN staff nurses who have undergone a presentation and training about how to administer the tool accurately. Nurses who use the tool will document in the patient's chart that they have administered the teach-back assessment tool. Charts will then be reviewed after a 90-day period to determine effects in readmission rates and reasons for readmission to the hospital. The number of patients who receive the assessment tool will be compared to an equal number of patients charts who receive standard care within the defined period of the study. In addition, patient satisfaction and staff perception of patient satisfaction will be assessed. Patients will be given a survey created by the primary investigator of the study to rate their satisfaction of discharge information and their view of comprehension of information. Staff nurses will be asked to provide feedback through a survey to express how they felt the use of the teach-back helped or did not help in providing patients with discharge information. The project will be performed at Ridgeview Medical Center in Waconia, Minnesota, on the inpatient surgical and orthopedic unit, which is a 10-bed unit. First, we must define who the stakeholders are that require education and each of their roles in the project's implementation. Stakeholders will include the patients, the hospital administration, the physicians, and nurses and other clinical staff. Stakeholders each play a role in the implementation of the project. The role of the patient will be to participate in the study. The patient will be given the teach-back assessment tool and participate in their discharge from the hospital. In addition, they will fill out the survey at their post-op appointment. Without the patients, there would be no project. The role of the hospital administration will be to allow the project to be performed at the site and support the implementation of the project. The role of the physicians will be to support staff nurses in the administration of the tool. The role of the nurses will be to administer the teach-back assessment tool. In addition, nurses' role will be to fill out the survey about patient satisfaction. The role of other clinical staff, such as nursing assistants, will be to support the nurses and allow them to spend time with the patient to administer the tool as needed. Howell 2005 discusses the importance of being a champion for your project and also creating an environment for the stakeholder. Engaging stakeholders will be important as it will help to get support and carry out the project. Howden 2008 says people don't get it. If they don't get it, they won't engage with the process. Therefore, strategy needs to be relevant for the individual. Stakeholders will be provided with education prior to project implementation as well as after. Providing stakeholders with necessary education will help to keep stakeholders engaged and help facilitate the project. First, we'll look at the patient as a stakeholder. The patient will be affected by the outcome, hopefully in a positive way, and there will be a need to implement changes within the hospital. Howden 2008 says that people can feel overwhelmed with innovation, so it is important to clarify and simplify the strategy with the end user in mind. Therefore, engagement will be simple and will focus on the potential benefits of the program. The educational needs of the patient include the actual discharge information needed on the teach-back tool. The intervention is based upon the social cognitive theory. According to this theory, 3 main factors affect the likelihood that a person will change their health behavior: self-efficacy, goals, and outcome expectancies. If individuals have a sense of self-efficacy, they can change behavior even when faced with obstacles. By empowering patients to understand their discharge instructions with the goal of not being readmitted, they should have the outcome expectancy of being able to care for themselves when faced with obstacles. Interventions are also based on the constructivism theory. This theory promotes using curriculum customized to the learner's prior knowledge and emphasizes hands-on problem solving. Next, the hospital administration will have educational needs. Their needs pertain to being informed about the project. Hospital administration will be provided with a PowerPoint presentation to help engage them in my dissertation project, as well as provide a time for questions and open communication about the project. Information will be provided about what the project entails and how the project will be beneficial to the patient, because it should help to improve patient outcomes. They will also be told about the financial benefits of decreasing patient readmissions. Howden 2008 discusses the importance of creating a shared vision so everyone involved has a sense of the big picture. This will be done with open communication. It will be emphasized that their support is needed to implement the project. These interventions are based on the communication theory. This theory says that multi-level strategies are necessary depending on who is being targeted, and interventions are to be tailored to the individual. Next, the physician's educational needs pertain to being informed about the project. Physicians will all be invited to a PowerPoint presentation to help engage them in the dissertation project, as well as provide a time for questions and open communication. The physicians will see how implementing a teachback assessment we can increase patients' knowledge and therefore hopefully decrease unnecessary readmissions. My desire is to get the physicians to engage and be supportive. This intervention is also based on the communication theory, which says that multi-level strategies are necessary depending on who is being targeted, and interventions are to be tailored to the individual. Other clinical staff on this unit, especially nurses, are stakeholders. Howden 2008 says people won't engage if they don't see the big picture or if they feel like the problem or solution isn't theirs. In order to engage nurses, I must get them to see that because we care for patients, they should be concerned about what is best for them. I will communicate with BSN RNs on the floor who will need to participate in the use of a teachback tool to implement the project. On a monthly work group meeting, the primary investigator of the study will provide a PowerPoint presentation about the dissertation project and how it will be implemented. It will be communicated that it will not take much more time to implement the teachback than a regular discharge and can be beneficial to the patient to ensure that discharge information is understood. Howden 2008 says that if you are scared, you won't interact with strategy. By creating a space of shared vision among individuals on the team, they will feel safe to interact. Open discussion will allow staff to interact and create shared vision as well. This intervention is based on the communications theory, which says that the interventions need to be tailored to the individual. Also, nurses will be provided with time to role play with each other with the teachback tool to practice its use. This is based on the control theory, which says teachers rely on cooperative, active learning techniques that enhance the power of the learners. So by using the tool, they will feel empowered to administer it to the patient. At the end of the project, a presentation will be given to all the stakeholders with the results of the project. Open communication with stakeholders will be used throughout to make changes as necessary and help stakeholders stay involved. By engaging and educating the stakeholders, as discussed, I believe it will allow for buy-in as well as a successful project.